Afternoon, everyone. Today we'll be talking about cellular adaptations. So, normal cell, when there is altered functional demand, the cell will try to adapt itself either in the form of atrophy, hypertrophy, hypoplasia, metaplasia, or dysplasia. And when the stress is removed, the cell will be restored to normal, like it will become the normal cell. And if there is mild to moderate stress, the cell will undergo reversible cell injury. Either there can be some degenerative changes or some subcellular alterations or intracellular accumulations. And when the stress is removed, repair and healing of the cell will occur. And if the stress is severe and persistent, then there can be irreversible cell injury will occur, either in the form of and this irreversible cell injury will occur, which leads to cell death, either in the form of necrosis or apoptosis. So today we'll be dealing about what are the cellular adaptations, this or atrophy, hypertrophy, hypoplasia, metaplasia, and dysplasia. So when these adaptations, when the stress is being removed, that is when the altered functional demand is removed, then the cell will be restored to normal. So now let's discuss what is the definition of cellular adaptation. These are the reversible changes as we discussed already, and it can be in reversible changes, it can be in the size, number, metabolic activity, morphology, or functions of the cell in response to environmental stress. So the cell is, it can be due to increased demand or decreased nutrients or decreased stimulation, or when there is chronic irritation, which can be either physical or chemical. If it is due to increased demand, the cell may undergo hypertrophy or hypoplasia. If it is due to reduced nutrients or reduced stimulation, the cell will undergo atrophy. And if it is due to irritation, metaplasia will occur. We will discuss this in the next slides. So what is hypoplasia? The word hyper means increase, plasia means number. So increase in this number of cells by cell division. This is called as hypoplasia. And it may be associated with the hypertrophy in some cases. Then what is hypertrophy? Trophy means size. And it means hypertrophy means increase in the size of the cell. And this depends upon the renewal capacity of the cell type. Like example, the stable cells, in stable cells, both hypoplasia and hypertrophy will occur. And the causes for this hypoplasia can be physiological or pathological causes are present. And if we see the physiological causes of hypoplasia, the following are the examples. It can be due to hormonal stimulation, like female breast during puberty or lactation, because the hypoplasia will occur. And uterus in pregnancy also undergoes hyperplastic changes. And it can be compensatory, like liver after injury, the liver cells will be undergoing hyperplasia. And one kidney, after the other kidney is excised, the other kidney will undergo hyperplasia. And after blood loss, the bone marrow may undergo hyperplastic changes. And why these changes are occurring? The mechanisms are due to excess production of the localized excess production of the growth factors and growth factor receptors. So there will be increased DNA synthesis, and hence mitotic activity is increased. That's why there will be hypoplasia. So there will be excess production of growth factors and growth factor receptors, and there will be increased DNA synthesis and mitotic activity. So here we can see these are the normal cells and the size has increased. This is the hypertrophy. And here there are 4 cells here. There are 6 cells here. There is hypoplasia. And if it is combined, the hypertrophy and hypoplasia is combined, there is increase in the size along with the increase in the number. It is the hypertrophy and hypoplasia. It is seen in pregnant uterus. And what's the causes for pathological hypoplasia? It is due to excess production of the stimulating hormones, like in the endometrium, because of the endometrium under the influence of estrogens, like estrogen producing tumors or exogenous estrogen intake, the endometrial hypoplasia may occur. Or prostate may undergo benign prostatic hypoplasia. It is due to excess androgen. And thyroid in case of Graves' disease. These changes can be reversed if the hormone is withdrawn. And other examples of pathological hypoplasia are hyperplastic polyps of the gastrointestinal tract, wound healing in case of like granulation tissue, there will be hyperplasia of the granulation tissue in case of wound healing. And because under the influence of HPV virus, human papilloma virus, skin warts will develop. This is also example for pathological hypoplasia. The rapidly proliferating cells, sometimes they can harbor mutations that could result in even malignancy. So, hypoplasia is a precursor lesion for malignancy. Example, endometrial hypoplasia may lead to endometrial carcinoma. And this is an example of erythroid hypoplasia, where this is the skull, this is a table of the skull. The thickness of the skull, table of the skull will be increased because of the marrow hypoplasia. And on radiology, this gives appearance as hair on end appearance. It is called hair on end appearance. And this is the endometrium. This is a normal endometrium where the gland to stroma ratio is very less, whereas here the glands are more numerous. And this is an example of endometrial hypoplasia under the influence of the hormone estrogen. And this is these small dark colored dots like things are, it is the endometrial stroma. These are the endometrial glands. These are the endometrial glands. This is the endometrial stroma. Endometrial hypoplasia, here we can see very clearly. This is a like polypoidal appearance of the endometrium. This is a uterus. And here we can see polypoidal appearance of the endometrium. And these are the endometrial glands, endometrial stroma. The gland to stromal ratio is very much increased in this. And this is the thyroid. It has enlarged. It has been enlarged because of the hypoplasia in multinormal goiter. And this is a normal thyroid. Here we can see increased number of these follicles here also. And the characteristic feature for hypoplasia, this is called scalloping. This is the reactive hypoplasia of the lymph node. You can see follicles with increased germinal center. This is a normal uterus. This is a hyperplastic hypertrophied uterus. This is a normal uterus. This is a hyperplastic uterus. Here, this number of cells and size of the cells has increased in the both slides. This is the prostate gland. This is the hyperplastic ducts we can see here. There's so many ducts have been, the ducts have been increased. This is again the picture showing prostate gland, hyperplastic prostate gland. This is a normal breast showing fibrofatty connective tissue and ducts, terminal duct lobular units. And here the ducts have been dilated and showing some secretion, that is milk, proteinaceous material. And the cell number, the ducts are also increased in number in lactation. This is a normal adrenal gland. These are the hyperplastic adrenal glands. This could be due to pituitary adenoma secreting ACTH, like Cushing syndrome, or it can be idiopathic. So next comes hypertrophy. Hypertrophy, it is nothing but, as we discussed, the increase in the size of the cells, resulting in the enlargement of the organ or tissue. Cell number does not increase, but the cell cycle increases. It is due to synthesis of more hormones. This is seen in cell types which do not have replicating capacity, like heart and skeletal muscle. And nuclei may show excess DNA also sometimes. And the causes, again, there can be physiological causes or pathological causes. The examples for physiological causes are like muscle during physical exercise. There will be, as there is increase in the functional demand, the muscle will undergo hypertrophy, skeletal muscle. And uterus in pregnancy, also the uterus, the smooth muscle cells may undergo hypertrophy along with hyperplasia. And pathological causes are hypertrophy of the heart, can be seen in systemic hypertension, mitral insufficiency, or aortic valve disease. As the heart has to exert more pressure, then because of that reason, the heart muscle will undergo hypertrophy. And this is a normal myocyte or heart cell. If there is just functional demand, like increased load is there, then you can try to undergo hypertrophy. Here we can see hypertrophy. And if there is cell stress is more, reversible injury might occur with through some accumulation inside the cell, or if the stress is more, the cell will undergo at cell death in the form of necrosis, that is myocardial infarction. Hypertrophy of the smooth muscle also occurs, in example in pyloric stenosis in stomach, intestinal strictures, and muscular arteries in hypertension. Again, this is because of the excess pressure each organ has to apply. So what are the mechanisms for hypertrophy? Is the heart is the best example of pathological hypertrophy. It occurs by altered genetic reprogramming, and there is increase in the use of additional structural proteins required for this hypertrophy, like induction of genes that code for transcription factors, growth factors, and vasoactive agents. Transcription factors like C-FOS and CGen, growth factors like transforming growth factor beta, insulin-like growth factor, fibroblast growth factor, vasoactive agents like endothelin-1, alpha-adrenergic hormones, angiotensin-2. All these causes increase cellular, hypertrophy. Change of adult type of contractile protein to fetal type. Example, alpha-myosin heavy chain is changed to beta form. So here we can see the transcription factors, genes for transcription factors, induction of contractile genes, contractile protein genes, induction of embryonic genes. All these are causing increased muscle activity. And in this picture, we can see left ventricular, this ventricular wall is hypertrophic. Again, we can see the hypertrophy of the cells, cardiac cells. And ultrastructurally, if we see that we increase synthesis of DNA, RNA, increase protein synthesis, and increase number of organelles also. So next comes atrophy. Shrinking in the size, mass of the tissue by loss of substance from the individual cells. The cells are reduced in size, but they are not dead. There are physiological causes like uterus after menopause, atrophy of the lymphoid tissue, thymus atrophy, gonads after menopause, thyroglossal duct. All these are the examples, physiological causes of atrophy. Pathological causes like starvation atrophy, disuse atrophy, like in case of immobilization for long periods, like the calf muscle may undergo atrophy. Atrophy of the pancreas might occur due to obstruction of its duct. Neuropathic atrophy because of loss of nerve stimulation, like poliomyelitis and motor neuron disease. And ischemic atrophy, like it occurs in brain in old age, kidney after renal artery stenosis. Inadequate nutrition, marasmus may cause muscle wasting, loss of endocrine stimulation like breast, uterus, and hypopituitarism leads to atrophy of gonads. And the loss of endocrine stimulation occurs in menopause. The breast and uterus may undergo atrophy. Aging or senile atrophy may also occur. Pressure atrophy also may occur because of the obstruction to the ducts, like gland atrophy. Tumors may cause pressure atrophy. Hydronephrosis of the kidney may cause atrophy of the cortex. So this is a cortical atrophy. As there is building up of because there is obstruction, there is building up of this urine here, and there is atrophy of the cortex. And the mechanisms for atrophy are in contrast to hypertrophy, there will be few mitochondria, myofilaments, endoplasmic reticulum, everything will be few. Cell requirements are brought to minimum. The shell will shrink, but it's not dead. But the cell may, in due course, undergo apoptosis, and balance between protein synthesis and degradation is tilted towards degradation. And acid hydrolysis of the lysosomes, they degrade the proteins. That's why there is atrophy. And degradation of cellular components occurs in this vesicles into which acid hydrolysis pour in and degrade the material. This is the atrophied adrenal gland. These are the normal adrenal glands. This is a microscopic picture showing the atrophied adrenal gland here. This is the atrophied brain. There is widening of the sulci and narrowing of the gyri. This is the same picture, widening of the sulci and narrowing of the gyri. Testis atrophy. The adjacent one is a normal atrophy. And here, this is the atrophied testis again, microscopic picture. This is the atrophied kidney, atrophied thymus, involution of the thymus, celiac disease, the villus atrophy will be there. These are the normal villi. Metaplasia is transformation of one type of reversible change of one type of epithelial or mesenchymal adult cells to another type of epithelial or mesenchymal cells. It reverts back to normal if the stimulus is removed. It may get converted into dysplasia. It can be either epithelial or mesenchymal. Squamous metaplasia, this occurs to withstand the stress in the environment, like example bronchial mucosa or endocervix or salivary gland ducts. And urinary bladder, the squamous metaplasia may occur because of the presence of calculi. Single-layered columnar epithelium will be replaced by rugged multi-layer squamous epithelium, which can withstand the stress. However, but there is loss of function, like ciliary motility is lost, which there won't be any ciliary motility in the respiratory tract, which does not protect from infections. Sometimes this squamous metaplasia may lead to carcinoma. Columnar metaplasia, in the lower end of the esophagus, squamous epithelium is replaced by intestinal epithelium. This is called Barrett's metaplasia, where adenocarcinoma may develop. Mesenchymal metaplasia is of two types, osseous and cartilaginous. Osseous metaplasia in blood vessel wall, Monkey-Buck's medial calcific sclerosis will occur. Leiomyoma and soft tissues in myositis ossificans. These are the examples. Cartilaginous metaplasia, because of undue motility in healing of fracture, cartilaginous metaplasia may occur. These are the changes seen in normal endocervical epithelium, squamous metaplasia, dysplasia, carcinoma in situ. This is a Barrett's metaplasia, where squamous epithelium is replaced by columnar epithelium. Osseous metaplasia we can see here. Osseous metaplasia of the kidney, Monkey-Bug medial calcific sclerosis in the vessel. Squamous metaplasia of the uterine cervix. Squamous metaplasia of the uterine cervix again. Squamous metaplasia of the urinary bladder. Dysplasia is disordered cell arrangement, often accompanied with metaplasia and hyperplasia. It is also called atypical hyperplasia, often seen in the epithelial cells. It is characterized by fall epithelial hypertrophy, hyperplasia, pleomorphism, increased NC ratio, loss of polarity, all those things. Often occurs due to chronic irritation or prolonged inflammation, and it may progress to carcinoma in situ or invasive cancer. This is an example of carcinoma dysplasia progressing to carcinoma in situ and carcinoma. So these are the cellular adaptations. One is hypertrophy, hyperplasia, atrophy, metaplasia, dysplasia. Thank you.